Next, we're going to be assessing the cranial nerves. First, we're going to assess cranial nerve 1, which is the olfactory nerve. So I'm going to have you close both your eyes here, and then I'll have you close one nostril, and tell me what you're smelling here.
Cinnamon.
Cinnamon. Now I'll have you cover your other nostril here, and tell me what you're smelling.
Garlic.
Garlic. Cranial nerve 1, the olfactory nerve is intact. You can open your eyes. Next, we will assess cranial nerve 2, which is the optic nerve. So I'll first have you close one eye and then the other, and then we'll assess both eyes at the same time. So tell me when you can see my fingers moving.
Now.
And
Now. Now. Now.
good. And I'll have you close your other eye and tell me when you can see my fingers.
Now. 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 Now.
Good. And we'll test both eyes here.
Now. 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 Now.
Good. Cranial nerve 2, your optic nerve is intact. Next, we'll assess cranial nerve 3, 4, and 6, your ocular motor, your trochlear, and your abducens. So first, what we're going to do here is the 6 cardinal fields of gaze. So I'm going to have you look at my finger and follow my finger for me, just with your eyes. And I'll hold this lateral gaze, looking for nystagmus. I'm not looking at or seeing any indirect or involuntary eye movements. You can look straight ahead now. No nystagmus is noted. Next, we will do the cover uncover test. So I'm going to cover this eye and look straight ahead. And now we'll cover this eye. Not noticing any gaze shifting or any eyes losing focus when they are uncovered, indicating the cover/uncover test is intact. And cranial nerve 3, 4, and 6, the ocular motor, trochlear, and abducen are intact. Next, we'll assess cranial nerve 5, which is your trigeminal nerve. So what we're going to do here is I'm going to have you clench your teeth. I'm going to palpate your temporal and masseter muscles. They appear firm and symmetric. Are you noticing any pain or tenderness?
No.
I'll have you open your mouth here. Not noticing any pops or clicks either. Good, you can close your mouth. Next, we will assess the sensation piece of the trigeminal nerve. You can open your eyes, and we will test light touch, sharpness, sharp touch, and dull sensation. So first, I'll have you close your eyes here, and this is what your light touch feels like.
Okay.
Alrighty, and tell me when you can feel me touching you.
Now. 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 Now.
Good, light touch is intact. We will now go ahead and do sharp and dull touch. I'll let you sensation. I will let you keep your eyes closed for me here. This is what your dull feels like, and this is what your sharp feels like. Alright, tell me which one you're feeling.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
You can open your eyes. Dullness and sharp sensation are intact. Cranial nerve 5, the trigeminal nerve, is intact. Next, we will go ahead and assess cranial nerve 7, which is your facial nerve. So I'm going to have you do a couple different facial expressions for me. I'll have you smile. Go ahead and raise your eyebrows. Good, show me you look scared. Good, now show me your frown. Good, cranial nerve 7, the facial nerve, is intact. Next, we will assess cranial nerve 8, which is the auditory nerve. I will be using a tuning fork to do the assessment. So with the tuning fork, we'll be doing 2 assessments. We'll be doing the Weber test and the Rene test. First, we'll do the Weber test. So I'll strike the tuning fork, and I will place the tuning fork in the middle of your skull. I will have you tell me whenever you first hear the sensation or hear the noise, whenever you can't hear the noise any longer, and if you're noticing it, hearing it more in one ear versus the other. We'll go ahead and do that here.
All right, I can hear it. And it's gone.
Did you notice any hearing differences in your right versus your left ear?
No.
No unilateral hearing loss is noted with the Weber test. We'll now go ahead and test the Rene test. So again, I'll strike the tuning fork. I will place the tuning fork on your mastoid bone behind your ear. Tell me whenever you can't hear it anymore. I'll then move it to the air near your ear and tell me when you can't hear that anymore. and we'll test both ears.
Now. Now.
Air conduction was roughly twice as long as bone conduction. We'll next go ahead and test the other ear here.
Now. Now.
Once again, air conduction was roughly twice as long as bone conduction. The Rene test is a pass, and cranial nerve 8, the auditory nerve, is intact. Next, we'll go ahead and assess cranial nerve 9 and 10, the glossopharyngeal and vagus nerve. So with this, I will use my tongue depressor and my light here. I'm going to first have you open your mouth for me here, and I'm going to use the tongue depressor, shine the light in there, and I'm going to have you say ah, ah, noticing the uvula move up, as well as the soft palate is moving up. I'm now going to go ahead and test your gag reflex. I apologize here. Gag reflex is intact. We'll now go ahead and test your swallowing ability. So I have a glass of water here. I will just have you take a swig for me. Swallowing is intact, and cranial nerve 9 and 10, the glossopharyngeal and the vagus nerve, are intact. Next, we'll go ahead and move on to cranial nerve 11, which is your spinal accessory nerve. I'm going to ask you to do a couple different movements to resistance here. So I'm going to have you shrug your shoulders. Good. And I'll have you move to your left. Good. Going. Good. And forward. Good. And back. Perfect. Cranial nerve 11, your spinal accessory nerve, is intact. Lastly, we will do cranial nerve 12, which is your hypoglossal nerve. So I'm going to have you stick your tongue out for me. I'm noticing that it's symmetrical, it's pink, maybe a little rough. I'll have you kind of move it side to side for me. Good, and up and down. Good movement with the tongue. And now I'm going to test your tongue strength. So what I'm going to do, I'm going to put my hands on your cheek, and I'm going to have you push against my hands for me. Good, and we'll test this side. Good. And strength is strong and intact. Strength is roughly a 5 out of 5. Cranial nerve 12, your hypoglossal nerve, is intact. And that is all 12 cranial nerves.